Hi, welcome back to SportsInjuryTV.com. I'm your host, Dr. Todd Narson, and you're watching the Weekend Warrior Show. This is the show for those of you who are wearing the business suit during the week, and on the weekends, you're putting on your triathlon suit and hitting it hard. This week, I want to talk to you about an injury that happened to the Miami Heat's Dwayne Wade last night. Last night was their first preseason game, and 197 seconds into the game, Dwayne Wade suffers a hamstring tear to his right hamstring. He hobbles off the court, and that was the end of his night. This is something that I've seen in my office many times, people coming in over the years with hamstring tears. I've actually suffered several myself. They're very painful. One time I actually suffered a double hamstring tear. Was running out in the middle of the field trying to catch a fly ball. One hamstring goes, 10 steps later, the other hamstring goes. What do you do to help these things heal? Now, there's a fundamental problem when these things are healing. But the thing is, the problem is also the thing that helps it heal. Your body heals with scar tissue. And the problem is that sometimes the scar tissue can heal tight, and the fibers of the tear will heal in a haphazard pattern, making it very difficult at the end of the rehab process to try and stretch it out and get it back to normal function, normal length. So what we've been doing here in the office is doing something that I call the ice stretch. Now, typically, the therapist or the physician will apply ice to the area, use some muscle stimulation, maybe use some pulse ultrasound, wrap it tight with an ace bandage to compress it, all the things that are great to help reduce inflammation and swelling and pain and so forth, and get this thing healing properly. But typically, they're trying to take the pressure off by bending the leg a little bit, reducing some of the tension on the hamstring, and then doing the therapies. What I've found is that doing an ice stretch, in other words, lengthening the muscle up to the point where the patient or the athlete is starting to feel it stretch, applying ice at that point, as well as your stim and your other therapies, will actually influence the scar tissue to heal over greater length. So what happens is, here's a piece of a TheraBand. So we can put the ice on it, say the tear is right in the middle here. We can put some ice on it and leave it like this. And what happens is the scar tissue will heal knotty right around that area. At the end of the rehab and end of the treatment, you're going to have to start working on stretching it once the hamstring's healed enough to start bearing that kind of force. But if you lengthen the leg, pulling the hamstring tight, now not tight enough to cause more tearing, but just tight enough to where the patient feels an increase in tightness in the leg. And then you put the ice on top of it and your other therapies. And at home, the patient can also lengthen their hamstring, doing a light stretch, and icing it. What's going to happen is you're going to have scar tissue that heals over a longer distance. Instead of a bulky, tight scar, you're going to have a longer, more flexible, thinner scar tissue that more resembles the function of the muscle tissue it's trying to heal. It's a great technique. On everyone I've used it on, not only have they gotten better somewhat faster, but at the end, they've ended up with less pain and greater range of motion, rather than typically with hamstring injuries, you'll see people that end up no pain, but they don't have as much range of motion as they did when they started. This technique, I found on every person I've done it so far, including myself, that we end up with greater range of motion. This is a great technique called the ice stretch, which is something you should ask your doctor about if you suffer an injury like this. So hopefully they'll do this with Dwayne Wade, get him back out on the court soon, and Miami will have their full dream team ready to go for the rest of the season. This is Dr. Todd Narson. You're watching the Weekend Warrior Show here on SportsInjuryTV.com. Until next time, see you later.